The mitral valve structure is composed of four components, which are the anterior and the posterior leaflets of the mitral valve. This is the anterior and this is the posterior leaflet. The mitral annulus that is attached to the heart endocardial cushion, the chordae tendineae, and the papillary muscles. So there are four structures: the leaflets, the annulus, the chordae tendineae, and the papillary muscle. In order for you to understand the causes and the pathophysiology, you need to go through these structures. What affects these structures will cause an element of mitral regurgitation. So, if we go to the leaflets, for example, one of the most important causes of mitral valve regurg is mitral valve prolapse. What is mitral valve prolapse? It is a protrusion of the leaflet of more than 2 millimeters inside the left atrial cavity. So when it protrudes inside the left atrial cavity, the coalesce of the mitral leaflets together will be impaired. They will not close. Perfectly well, and leaking of blood through the valve from the left ventricle to the left atrium will happen. This is one of the causes of valvular leaflet pathology is the mitral valve prolapse. Other leaflet pathology is associated within the leaflets, let's say the vegetations, infective endocarditis that destructs the valve. This also causes an element of mitral valve regurgitation. Other causes like that affects the chordae tendineae, chordal rupture, either by ischemia or either by infective endocarditis. This rupture of the chordae, it causes a flail leaflet of the mitral valve, and the valve is lost almost into the left atrial cavity. Complete loss of the function of the leaflet will cause an element of significant regurgitation. While talking about the annulus, if the annulus is dilated, it will cause an element of secondary mitral regurgitation. Papillary muscle dysfunction caused by ischemia or other causes, when it is weak, they are not able to function well. They are attached to the chordae tendineae, to the leaflets, so the leaflets will not close perfectly well to each other, leading to an element of mitral regurgitation. And also, as we know, that mitral regurgitation is classified into an acute and chronic conditions that we will discuss. Here is one example of a leaflet pathology that caused mitral regurgitation, which is called the cleft in the mitral valve. What is a cleft? This is the cleft in the mitral valve, in the anterior leaflet in this image. For example, where is a defect in the leaflet itself, it's not well developed. For this reason, when there is a defect in the leaflet, closure will not be complete and an element of regurgitation will happen. And very important for you to know, when there is a cleft in the mitral valve, this condition is associated with a primum atrial septal defect. This is very important for you to know. This is an example. Those are examples of the causes of the mitral regurgitation we will discuss. This is the mitral valve prolapse. As you can see here, the leaflets are prolapsing and bulging into the left atrial cavity. And in conditions when there is this bulging is significant, it will cause an element of regurgitation, as they do not close perfectly well. This is an example of a flail leaflet where the chordae tendineae are ruptured and the valve leaflet itself goes into the left atrial cavity. And this is an element of an infective endocarditis here. This is an infective endocarditis. Vegetations are destructing the valves, and also they cause an element of mitral regurgitation. So what is mitral valve prolapse exactly is? It has many names: mitral valve prolapse, floppy valve syndrome, or click murmur syndrome. It is described and defined as a more than 2 millimeter displacement of one or both mitral leaflets into the left atrial cavity during systole. It is inherited as an autosomal dominant and has an equal prevalence between males and females. Two important notes that you should know about. Mitral valve prolapse itself is not symptomatic at all. And if symptoms are going to be related to the mitral valve prolapse, they only produce symptoms when it is associated with significant and severe mitral regurgitation. Otherwise, mitral valve prolapse, it is not associated with symptoms itself. In the past, they used to say that there is something called mitral valve prolapse syndrome, where the patient used to have palpitations, shortness of breath or dizziness, but now they all know that these manifestations and these symptoms, they are not related to the mitral valve, as more than 70% of healthy individuals who have no mitral valve prolapse, they have turned out to have the same manifestations, which is related to another cause. So the first thing you should know that it is asymptomatic, and the second thing that you should know, it is associated with a mid-systolic click followed by a late systolic murmur, and this murmur, it increases in duration during maneuvers of Valsalva and standing. And this is the most powerful diagnostic tool. If you hear this mid-systolic click followed by late systolic murmur that is provoked by maneuvers, this is sufficient for you for a clinical diagnosis of mitral valve prolapse, even without the aid of an echocardiography. How we diagnose mitral valve prolapse, how we diagnose mitral regurg, we depend, number one, on the two-dimensional echocardiography. Regarding the pathophysiology of mitral regurgitation, we will differentiate between the acute mitral regurgitation and the chronic mitral regurgitation, and we will start with the chronic condition. What happens with mitral regurgitation? As you can see here, that during the blood flows from the left atrium through the mitral valve during diastole and into the left ventricle. So when the left ventricle it contracts during systole, it pushes the blood back and pushes the blood through the aortic valve into the aorta. So during systole, the mitral valve is closed. Mitral regurgitation is defined as the backflow of blood from the left ventricle back to the left atrium during systole, and this will form an element of a systolic murmur, which is a pan-systolic murmur of mitral regurgitation that may radiate to the axilla and sometimes may radiate to the back. So this blood in chronic condition will be reflected back to the left atrium, and with more severe regurg, the blood will be reflected back even to the pulmonary veins and even to the pulmonary capillaries. And as we discussed earlier, we said that during end diastole, the left ventricle at end diastole, okay, the pressure here, left ventricle end diastolic pressure equals the left atrial pressure equals the pulmonary capillary wedge pressure. This equation, you should be aware of it, as the blood is reflected back from the left ventricle to the left atrium. When it comes back to the left ventricle, what will this cause? It will cause an element of dilation of the ventricle, because more blood is coming to the left ventricle. So the left ventricle will dilate, and this dilation will, at the first stages, the pressure will not be increased, but at end stages, the ventricle cavity will dilate, and the pressure starts to build up inside the left ventricle as it cannot accommodate more blood, and this pressure will be reflected back to the left atrium and to the pulmonary bed, and at this time congestion and leakage of fluid into the pulmonary alveoli starts to happen, and the patient starts to be symptomatic. The more severe the regurg, the more reflection back of flow and reversal of flow happens from the left ventricle back to the pulmonary bed and the pulmonary bed, and the patient becomes more symptomatic, and leakage of fluid from the, as the blood is reflected and the pressure is reflected back, it will cause an element of pulmonary hypertension. Pulmonary hypertension with leakage of fluid into the alveoli, and the patient will start to go into pulmonary edema. This is an example of the mitral regurgitation here at the left side. This is the mitral valve, this is the left ventricle cavity, this is the mitral valve, and you can notice that this mosaic pattern reflects the regurgitant flow from the left ventricle back to the left atrium, and this is a state of hyperdynamic circulation. The ventricles are contracting strongly. This is due to acute mitral regurgitation that we will discuss now. This is a chest X-ray that reflects the congestion. How we would know that the congestion, there are congestion in the lung. From a chest X-ray, we will see what is called the upper lobe diversion and the peribronchial coughing. Hilar congestion, upper lobe diversion, peribronchial coughing, those are all clues that they give you in real clinical life, that you will see it, and you will also see them in your clinical MCQ exams. Upper lobe diversion, how we would define congestion, there will be upper lobe diversion and peribronchial coughing. The bronchioles here should be empty, but they are filled here. They are filled with fluids. This is called the upper lobe diversion and peribronchial coughing. We also see the curly B lines. What are curly B? What are curly A? What are curly C? Curly B lines, they are usually perpendicular, as you can see here, perpendicular to the pleura, and they represent congestion. Curly C lines, those are curly B, they are perpendicular to the pleura. Curly C lines, they are found at the base of the heart, and also they represent advanced stages of congestion. Curly A lines, they are present at the upper lobes, and they are directed toward the hila, and they represent an element of either congestion or lymphadenopathy in cases of malignancy. This is another example of mitral regurgitation as diagnosed by angiogram. Here on the left image, you can see this is where the left atrial cavity, it's not very obvious, but this is, I can guess that there is an element of mitral regurgitation. This is a very beautiful MRI image of mitral regurgitation. As you can notice, this is chronic MR causing dilation of the left ventricle cavity, and the severity of MR, you can see that it is severe, hitting the wall of the ventricles, and they are even reflected back to the pulmonary veins.